Good morning.
Are you okay?
No, I think I slept wrong.
Maybe you should go see a doctor.
A doctor?
During the first part of a typical meeting with the patient, I know I need to get to the correct diagnosis. In order to do so, I listen very carefully to the patient's history. You see, musculoskeletal dysfunctions have patterns to them, so I listen for hints to those patterns. I'm also making sure that I'm looking at their demeanor and making observations as to their posture. When they're done, I'll start bombarding them with all sorts of questions, sometimes so many that it feels like an interrogation. So you have neck pain, huh?
Yes.
So when did it start?
Last week.
What'd you do?
Well, I just woke up with a crick in my neck one morning.
You can't remember a single thing? It just came to you out of the blue?
Yes.
When does it hurt?
Well, when I turned my head to the left.
Are you sure you didn't do anything to cause this? You weren't out trimming trees, painting ceilings, working on a long computer project in a non-ergonomic position?
No.
Well, what do you do for a living?
Well, I hula hoop. I eat fire. I'm a contortionist, but I'm real good. I wouldn't injure myself.
Are you sure none of that would have caused this?
No.
And there's nothing else, nothing that you could have done out of the ordinary that would have caused that?
Well, there was that one thing.
Now, there's usually about 3 types of tissues that cause pain. The joints, the soft tissue around the joints, and nerves. Now, I know a lot of you out there are thinking the muscle's the culprit, but it's not. Indeed, my patients usually tell me, look, doctor, look here, feel that muscle, feel how hard that knot is. It's not the muscle, it's what's underneath the muscle, which is the skeleton. That usually is what causes the muscle to spasm. The muscle's the messenger. Don't shoot the messenger. So when I see the patient with neck pain, I usually want them to show me exactly where they're hurting. Now when they show me, I'm going to look at their gestures. If they point to the back of their head and they come forward, I'm going to think of something like occipital neuritis. If they point to the middle aspect of their neck, I'll think of a disc or perhaps a joint injury. If they point to the back part of their shoulder and they tell me that the pain radiates all the way down, I'm going to think of something like a radiculopathy or a pinched nerve at the root area. Now in today's segment, what we're going to talk about is the uppermost part of the back of the neck area. Now this area is called the occiput. At the occiput is where your ligaments and your muscles attach, and what they do is they offer movement and support. Now, you have a big old head there that needs to be supported, and in order to do so, they have to be nice and strong. Usually they don't have a problem holding you up, but what they do have a problem with is when you hyperextend or you hyperflex, and that creates pinching or pulling in that area. Now, when I see the patient with neck pain, I usually find that they have one of 3 things that's causing their problem. 1 is they're going to have poor posture. 2 is they could have had a previous injury. Or 3, they have poor ergonomics. Now, what is ergonomics?
Ergonomics is a study of people's efficiency in the working environment.
Working environment, huh? You know, it used to be that when we were at work, we'd be in one position for a couple of hours, then we'd take a break, maybe go to another position, etc. And by the end of the day, we'd go home and we'd do something completely different. But all that's changed. We now have the same devices at home as we do at work. We have computers, we have pads, we have phones, we have watches, and we take them everywhere and anywhere we go. Thus, our working environment has expanded exponentially. Now here's the clincher. For the most part, our bodies will comply, but there is a limit. Now, for some peculiar reason, our eyes stare at or follow these devices, even if it means sacrificing our posture. You see, all things being equal, your flexibility goes down as you age, and things do break down even faster if you mistreat them. So when I see a patient with significant neck pain along this upper region, I always make it a point of looking at their posture. You see, postural imbalances make a big difference. And I'll share a secret with you. I always look at the pelvis. You see, much of the position of the neck is completely dependent on the foundation of the spine, and that's the pelvis. So after I listen to the patient, I begin my physical exam. The first thing I like to do is make sure their neuromuscular system is intact. I check their reflexes, sensation, and strength. Now, these are hugely important because if they're abnormal, that usually means that there's a significant neurologic problem that I need to uncover. Then I usually have the patient show me if they can rotate their head, first to the left and then to the right. If I see them slouching, I'll have them sit tall and repeat this exercise, asking if it hurts less or more. Then I'll notice if their range of motion is better also. This keys me into whether or not arthritis or bone on bone is playing a role in their pain. Next, I'll ask the patient to point to their pain. Now, most patients use their entire hand to show me where they hurt, but the pain is really from one small area, and that's why I use the one finger rule. I want them to show me their pain with one finger, and I want to be able to reproduce their pain with one finger. Then all I have to do is ask, what's under that finger? Anatomically speaking, that is. So if the patient points to the midline area, I think of the supraspinal ligament. Now, the supraspinal ligament is a ligament that goes all the way from the occiput along each spinous process all the way down to the sacrum. Now, at every single point where this attaches, it's a potential area for injury, either because we bend too much forward or we bend backward too much and get it pinched. So what if the patient has pain, not midline, but over lateral to that, over this ridge or this occipital prominence as it's called? Well, then I think of the greater occipital nerve, and when that gets pinched, these patients are miserable. This is a nerve that gets pinched, and nerve pain is intense. Now, why would that happen, and why would you actually pinch a nerve there? Let me explain. So in order for the greater occipital nerve to do its job, which is to supply or provide sensation to the top part of the scalp, it has to get there. In order to do so, it has to come from the spinal cord, traverse its way through a maze of different muscles, and then poke its way out of this thick ridge of tissue here. Now, normally it doesn't have any problem with that, and it does just fine. However, if we put ourselves in extreme extension or flexion or these odd positions, it gets pinched, pulled, or squeezed and causes irritation to the nerve. If that happens, it causes tremendous pain. The pain usually radiates from that area of impingement up and over the scalp, and sometimes even gives you referred pain behind the eye, and thus often it is confused with headaches. But don't let that happen. Just think about it. Now, if we move our finger far lateral, let's say just behind the ear, and that's where the pain is, I think of the insertion site of the sternocleidomastoid. Now, this muscle originates here along the sternum and the clavicle, and it goes from here all the way up and attaches here behind the neck, just behind the ear. Its function is to bring your head forward and side to side. Now, it's important to know if this is the area of injury because it's treated a little bit different. The symptoms can be a little bit vague, but also it can send pain up and over to the ear. So it's important to figure this out for the right treatment. So let's say you think you have one of these areas of discomfort. What's the first thing you can do? Understand and improve your posture. For this, we need to, at a minimum, begin not here along the neck, but here along the pelvis. You see, the pelvis plays a very pivotal role in understanding the posture. It's the foundation on which your entire spine sits on and is supported by. Control your posture here, and you'll spare trauma here. Let's look at a few examples. Take a peek at our exercise videos and see if these help. Now, if you've had poor posture for some time, it could be that you're going to have musculoskeletal imbalances that really need to be worked out by somebody else. For that, I suggest you see your physician and get referred to a really good board-certified physical therapist that has a special interest in manual therapy. But overall, remember, your posture at work and at home plays a pivotal role on your recovery. Well, overall, I hope you've enjoyed this segment. We've enjoyed making it, and I hope it helps you and you stay tuned to our next one where we try to tackle other reasons for neck pain. See you then.